We have spoken a bit about several different types of influenza strains, including seasonal influenza, swine flu, avian or bird flu, and now we're going to move on to discuss pandemic influenza, which is important because of its potential to cause global disease outbreaks. There are generally three criteria which have to be in place to allow this to occur. You have to have a novel influenza virus, a new one that emerges, to which there's very little immunity among most individuals in the world. It generally has to cause some significant illness, and lastly, it has to spread efficiently from person to person. If all three of those criteria are met, then we certainly could be in for a major risk of a pandemic. So what is the major difference then between seasonal flu strains and pandemic strains? Seasonal strains occur on an annual basis by definition. They have infectivity rates in somewhat lower ranges, 5 to 20%. They may cause thousands or tens of thousands of deaths in the U.S. They may cause 500,000 to 1 million deaths worldwide. Usually have a 7 to 10 day period of recovery after infection and will affect the elderly and individuals with underlying illness more severely. There's also a vaccine which we would have readily available in almost all cases to prevent seasonal flu. Pandemic strains, on the other hand, occur as major outbreaks 3 to 4 times every 100 years, so roughly every 25 years, something like that, every 30 years. The infectivity rates are much higher, 15 to 40%, because instead of 36,000, upwards of 500,000 or more U.S. deaths, and perhaps 50 million or more deaths worldwide. The recovery period is longer, typically, than 7 to 10 days, and rather than affecting preferentially the elderly and persons with underlying illness, they may affect the young and relatively healthy persons. Also, because of the way they emerge, there generally is no strain-specific vaccine available at the onset of a pandemic. Pandemic influenza has occurred a number of times in recent memory. That is, memory of individuals who have been around into the early part of the 20th century, the last 100 years or so. The 1918 strain, there was an underlying situation, of course, that we were at the end of World War I, a lot of movement of troops and personnel around the world. That strain of H1N1 influenza that occurred was known as the Spanish flu. It had many different names, but probably best known in the U.S. as the Spanish flu. Killed perhaps 500,000 persons in the U.S. and maybe 50 million people worldwide. That was the big one of the 20th century. 1957, a much smaller outbreak of the so-called Asian flu, H2N2, killed about 70,000 in the U.S. And then in 1968-69, the Hong Kong strain of H3N2 killed 30,000 plus in the U.S. Much more recently, and I'm certain everyone recalls the 2009 outbreak of H1N1 swine type that killed over 10,000 people in the U.S. and wreaked havoc for a period of time in terms of our planning and responding to addressing the needs of the population. Considerations for pandemic flu. First of all, it's important to recognize signs and symptoms as early as possible so that individuals who are infected can be effectively managed. And to prevent transmission, there are a number of different measures which should be employed routinely. Of course, these are the ones that might be utilized anyway in seasonal flu, but perhaps emphasized even that much more strongly. And those include cough etiquette, coughing into the bend of your elbow rather than into your hands, the use of frequent hand hygiene with hand sanitizing agents or hand washing, the isolation of suspected cases, and good general infection control practices such that approaching the individuals, we are not likely to acquire the infection ourselves nor to transmit it to others. For pandemic strains, we would certainly hope there'll be the possibility of post-exposure prophylaxis with antivirals and treatment of those who are infected with a suitable antiviral. We don't know that in any given case, and certainly it's impossible to predict that. But vaccine utilization for the seasonal strain that may occur in parallel with the pandemic strain is appropriate, and of course the use of the vaccine specific for the strain in circulation during the pandemic itself, the cause of the pandemic, should be utilized with appropriate priorities to protect first the most vulnerable individuals. And then often overlooked are the needs for developing return to work criteria. When is it safe for a person to come back to work? And this is clearly important in order to prevent additional unnecessary transmission of cases in the workplace. Those criteria will be worked out quickly in most cases based on the specific strains that are involved, and additional guidance, of course, will come from public health authorities, most specifically the National Authority, the Centers for Disease Control and Prevention. And so we've looked at a number of different considerations regarding flu, seasonal influenza, swine flu, avian influenza, pandemic influenza. Certainly future research hopefully will guide us toward the development of a vaccine that might cover all future strains, to find the core elements within the virus that don't change, that might be utilized in a protective vaccine against a number of future strains, and perhaps a whole variety of mutations from that. But until then, infection control practices are key and will continue to be utilized to prevent disease in our homes, in our communities, and across the nation.